Let's get started. For those of you who are not familiar with Global Integrity, we are an international nonprofit organization based out of DC, and we work with partners in countries and communities around the world. Our specific goal is to support partners' efforts, locally led efforts to address challenges related to corruption and the delivery of public services. So of course, when everything has been happening right now in India with COVID, I was like, this is exactly what we should be working on and talking about. And specifically, we believe in locally led learning and adaptive approaches to problem solving. So I'm coming into this conversation with a lot of questions, but not with a lot of answers. So I just wanted to say where I actually, my interest for all of this is that I actually was in India last year, and during the lockdown when COVID hit. This is me and my family, my son and my daughter, March 14th in New Delhi airport. So you can see, like, not only were we unmasked, but the international situation was very, very, very open. Nobody was really rushing that much at that time. People were still really confused what COVID was. But this is probably the photo that I want to draw the most attention to, which is we were actually in New Delhi last year during Holi, which is a very, very big national holiday in India. It's a cultural holiday. And people are out in the streets from first thing in the morning to the end of night, and it's crowded and it's chaotic. And the country was under lockdown. And I remember telling my husband at the time, there's no way you can lock down India during Holi. And yet here you have it. Here are my kids walking very lonely, middle of the day in Delhi, nobody around, just a little bit of paints on the street. And the country successfully was able to really keep its COVID cases at a very, very low rate and a really low minimum at that time. I remember also being a little bit proud and sort of bragging about it when I came back to New York. Everything was shut down. People were panicking. February 1st, when I was in India, way before COVID even hit and was at its peak, we were already flying to Bihar, which is one of the poorest states in India in the Northeast. And when we would land into Bihar's airport in Patna, the capital, there were already signs in the local languages about COVID. People were already being educated about how to wash your hands and what to watch out for in terms of fevers. This was way before anyone in Brooklyn was even shutting down like their brunches or their bar hours. And so I really kind of felt like, oh, wow, India's being really ahead of the curve. And it really felt like that was absolutely the trajectory until about 2 months ago. So the people and the experts here that I brought together from the fields of data science, economics, sociology, and of course, journalism are here to sort of talk a little bit about what's actually happening on the ground. I think a lot of us have unanswered questions. So I wanted to first head it off to Divya Manocha, who's a fellow of mine with the Solutions Journalism lead cohort. And she's calling in from Pune, which is sort of the epicenter. And she's going to tell us actually what is happening and how we got to this place.
Hey, thank you very much, Ambika, for setting this up and for inviting me, and also to Open Gov Hub. And thank you all for joining in and contributing to the efforts on the ground in India. I wish it were a less somber occasion, but we are where we are. I say this because I'm in the epicenter of the COVID-19 surge in India, so Pune, and it has now over here become common to hear ambulance sirens throughout the day. So you're probably keeping track of the numbers, and that's why you're here. As of yesterday, there were 414,000 new cases across India, and this number is likely to be severely undercounted. Now, unfortunately, there's an upper limit to how long numbers can mean anything to us. After more than a year of being in a global pandemic, we've become somewhat desensitized to the concept of scale. So to ensure that this desensitization doesn't stop us from being understanding of the situation, it is important to remind ourselves that numbers, actual lives, actual friends and family members. I actually find this data visualization a useful reminder. Let me just share it with you. So essentially, each dot over here represents one life lost. And as we scroll down, so we start off early Feb, and we go all the way down to April, you can start to see that these dots, which represent actual people, are getting closer and closer together. It becomes much more dense. And that just is there to show that, the numbers are overwhelming. It is a frightening time. Yeah, so how did we get here? So Ambika explained a little bit about the first surge, but the situation then was very, very different. The peak then was actually less than a quarter of today's cases, and we haven't even hit the peak yet. Until March 11th, the country was actually witnessing a downward trend in cases. However, political rallies, mass gatherings at festivals, more transmissible variants, and a slower than ideal vaccination rate have actually fanned the flames of a fire that was still smoldering and not yet extinguished. So you might be wondering, what is it like today? So what is it like to live in India during these times? Are massively overburdened, with severely ill patients not being able to access oxygen cylinders, medicines, ventilators, and beds. Many are being asked to actually bring in their own oxygen and ventilators to hospitals. And as for beds, there are 0.53 beds for 1,000 people in India. Just let that sink in. And this is as per the World Bank statistics in 2017. And while this number has increased due to the pandemic, it is nowhere near enough to provide life-saving support for India's most vulnerable people. And what do you do when the hospital near you can't accommodate your loved one? A lot of people actually turn to WhatsApp groups. So WhatsApp groups today are buzzing with messages containing details of severely ill family and friends, the cities in which they live, their blood groups, and their age. In response, phone numbers of oxygen suppliers, ambulance drivers, etc., are being forwarded from one mobile phone to another. But every message must be scrutinized closely before following what it says. The spread of misinformation due to WhatsApp is only adding fuel to the fire. It is this misinformation that is leading to people receiving vials of coconut water and milk in place of remdesivir. And what do we turn to when there is so much unchecked information? Naturally, to the supposedly transparent and accurate media. However, the media too has been guilty of incorporating bias, sharing unverified leads, and providing insufficient attention to the COVID-19 situation as it began to escalate. So these conditions have led to increased polarization among people and a rise in messages of anger towards the government, which we can all agree is not constructive in this scenario, when a non-partisan approach might even be more successful. Part of why I am here is because, just like Ambika, I am part of the Solutions Journalism Network, where we believe that it is important for journalists to throw light on initiatives, people, and approaches that are doing things better. Essentially, solutions journalism is all about conducting rigorous investigative reporting into solutions to social issues, including polarization. And this is also the reason why I think India can benefit considerably from a solutions lens. At this point, I am presenting you with an on-the-ground news report of sorts. And I'm sure Radhika will mention during today's conversation that in a situation where the shared experience is mostly that of fear and distrust, we see so many situations where humanity comes together. And with the media objectively reporting on initiatives that exist to improve the situation, like food distribution services, community helpers, and more, I actually believe that we can grow the hope that we need to fight together through this. It is important to say that solutions journalism is not just positive news, but useful news. Imagine how useful it would be to have articles like, what's working? What can we learn from the way that XYZ state has handled its rising cases? From a journalism perspective, changing the narrative and having a more solutions-focused lens to reporting can play a large role in redirecting attention to communities that need it and to transform feelings from uncertainty and fear to hope and positivity.
Thank you. And I think that that's a good segue. Sorry, that's a good segue into saying, as of right now, we've raised $2,500. That's only, the campaign's only been live for a week. And so Isabella is going to also put more links to donate in the chat. And so we can see if, if people are able to spread the word as well. It's really amazing, actually, that I think one of the biggest things that happened right after the crisis happened was that there was all these organizations putting out which organizations to support. And going back to what Divya said, there were so many community-based organizations because there's food issues, there's hospital issues, there's religious issues, there's all these things that are happening, aid issues, international organizations supporting. We spend quite a bit of time figuring out who the organizations we're giving to. And one of them specifically does migrant food work. And then the other one specifically does stuff around oxygen. A good friend of mine in the UK, her family member was recovering in the hospital yesterday from COVID and then did not get oxygen. Now he's passed away. And so I do think that the oxygen containers I can't stress enough how much the oxygen containers will make a huge difference. And so I want to hand it over to Vijay Pratap right now, who is the CEO and founder of Gramvani. Vijay and I worked together on a Feedback Labs accelerator program. And Vijay, even before all of this was happening 2 months ago, has been really crunching COVID data and reporting on COVID data for the last year, regionally, class-wise, gender-wise, everything throughout the entire country. And I think that's a huge question that are in people's minds, like where are the disparities, who's getting what access are people having? So Vijay has a lot to say about the numbers in the last 2 months, so I'm going to hand it over to him.
Thank you so much, Ambika. Wonderful to be on this platform. And yeah, as Divya rightly said, I truly wish it was a much better situation to be in and to be sharing better updates. But as it is, I guess we're all holding up as best as we can in these challenging times. I'm based out of Bangalore, and and situation isn't as great here as well. I mean, as Divya rightly mentioned, we've gotten used to, people all around us getting affected, our own families getting affected, friends getting affected, listening to, the silence of, ambulances going around, getting a news, a difficult news. You hear a call from your friend or family unheard of for a past few months, and you're scared because you fear something that you wouldn't want to hear. So, but that's how the situation is. Now, the question remains. Now, I'm sure, all of us know enough about what's happening. I'm sure we're seeing enough of that on media. I think the first wave of the COVID, pandemic in 2020 actually exposed the loopholes in the public service delivery system, especially with respect to the social welfare. We all were witness to the sweats or the exodus of migrant workers leaving and getting back to their hometowns. It was quite a painful visual. So the time gap actually between the dip in the number of cases from the first wave, to the current surge could have actually been used, much more effectively to address, to better the systems and to strengthen the infrastructure. And when the system already knew that the second wave was inevitable, the third wave is inevitable, right? So I think there are enough experts who've been speaking about it. Gramvani, we are an organization that builds community-based media platforms, and with the objective of reversing the flow of information. And why do we do that? Because the point is that we need to hear the voices from the ground. We need to hear, every district in the country, every village in the country is facing a different kind of challenge, right? So many of these challenges we may not be able to comprehend or to understand. It may not just be about health issues. It may also be about social or economic challenges rooted in, a lot of, gaps or disparities that have been there for ages. The pandemic only just bore it all out in the open, right? So first time in the first wave, it was primarily about migrant workers. This time it is about the crumbling health system. Gramvani's, the COVID response efforts starting in March 20 till about December 2020 or Jan 2021 actually catered to about 2.5 million calls, primarily from the low income, urban and rural population segments that we service across the central part of India in states like Bihar, Jharkhand, MP, UP, large areas of media dark, communities who do not have access to conventional media platforms, each of them facing challenges and problems which most of us would not even be able to understand. So the point is that how we were able to repurpose many of these platforms. We were able to hear these challenges. We were able to use the platforms to gather more than 25,000 voices from communities across the country, working with 30 plus partners, more than 1 million plus people touched during that particular period. Issues ranging from access to health issues, confusion regarding what COVID was, access to health services, issues pertaining to primarily issues pertaining to a lot of the government social benefits and entitlements that were promised, but they were not, most of them did not get access to. Why did they not get access to? That is why we did a much more detailed study to understand the reasons for exclusion, right from issues pertaining to the Manrega card registration not happening for 2 years despite having provided the data, issues pertaining to Aadhaar card linkages to the bank accounts. There is an entire report. I'll of course share that report in the link. It just speaks about the reasons for exclusion and how communities were able to come out to address some of these challenges, how there were interim measures used to address some of these challenges. And what we did subsequently was to actually pursue targeted interventions or targeted policy advocacy interventions to try and push the local authorities to institutionalize some of these interim measures so that they do not become short-term, band-aid sort of resolutions, but try and see how we can make them much more long-term. Use these pandemic, the pandemic, as I said, just it was all existing, it was already there, but just the pandemic, it was almost like just remove, it was a gush of wind that actually blew the blanket open and really put everything out there, right? So what we've been trying to do is using these voices that we get from the ground as evidence to prove the sort of challenges or issues, the nuances or the contextuality of these issues that people were facing across districts, across even villages or blocks in the country, right? So that's what Gramvani has been doing till the last 2 months, right? So first time it was largely about the issues pertaining to the migrant workers. This time, or social welfare and entitlement. This time it is about the health-related issues, right? So the gaps still are equally bad as the urban centers. Like for example, access to beds. It's even further. It's even more bad because the number of hospitals, as Divya also said, the number of doctors per thousand population is extremely low, and it's even worse in the rural sector. Access to medication, understanding or awareness of many of these aspects, right? So, for example, when you tell an educated individual saying that check your oxygen levels, check your temperature, you cannot use the same terminology with the rural population. Many of them would not understand these terminologies, right? So how do you bring that sort of awareness that's required? And this is what actually leads, and with the proliferation of WhatsApp and social media, the myths and misconceptions further lead to even more chaos, right? Firstly, they do not understand standard terminology and information that's being provided by the government or local authorities. Secondly, the myths and misconceptions further complicate the matters for them, right? So these are the sort of issues that we've been kind of facing, seeing from the ground. We're hearing those voices. On top of it, the sort of challenges pertaining to vaccination. In some of the states, like for example, one of the districts which is about 4% of the population of Haryana, actually has less than 1% of the vaccination done. A lot of people are, afraid of vaccination. A lot of people, stay quite far away from the vaccination centers. A lot of people do not understand the importance of vaccination. There are lots of myths and misconceptions. Like, for example, a lot of them wrote to the state government saying that we do not want to get vaccinated because, there is pig fat in it and it will cause infertility, right? So, these are the sort of issues that are there in rural areas firstly, because of lack of awareness, lack of contextual information access, and two is the lack of trust in the entire system because of the sort of challenges they've already seen over the past 1 year. So these are the kind of things that we have been learning, and our efforts. And as I said, everybody knows a lot of these challenges. The point is, what are we doing about it? And this is where, of course, I'm sure we'll get more opportunities to speak about it during this call. The point is that how do we mobilize communities? How do we get the communities to become more empowered? How do we action youth from these communities, organize community-based organizations who can really action and really deliver the required support on the ground, right? So that is what we at Gramvani are focusing on. So I'm sure we'll get to talk more about it during the course of this conversation. So thank you, Ambika. Thank you very much.
Thanks. And I just wanted to say how much I appreciate not only the way that you're doing data collection through mobile, but that you're actually trying to do more qualitative and actually understand what's happening rather than this percentage of people are being affected by this. It's much more nuanced and detailed. And that's one of the things I really love about your work. A question came in from Netta, actually, who is the director of the OpenGov Hub, which is exactly was going to lead me to my next point. So I'm glad that we got there, because so far we've been talking a lot about this, but nobody has talked about Modi or talked about the government. So Karna, just wanted to ask you, why isn't the government going under lockdown? Is, really, what did the government do well in their first COVID efforts that they're not replicating now? How much of this is about money and the economics of the situation?
Hi. Sorry, I did unmute myself. Thanks, Ambika. Thank you very much for organizing this. I'm happy to talk about this. So the other panelists are much better experts than I am, but I have done a little bit of thinking about sort of some of the big picture issues associated with lockdowns. So let me lay out some considerations that I think should be need to be grappled with. So many countries have faced very difficult trade-offs between protecting lives and protecting the economy. And I think reasonably, if you look across the board, there's generally been an emphasis on protecting lives at this stage. But it's still hard to get this policy right, because a lot of this depends on domestic inequality and on global inequality. So let me talk a little bit about the first lockdown and then think about what that might tell us about the potential of a future lockdown. So the first lockdown, what we do know is that it definitely adversely impacted GDP. So the numbers clearly tell us this. Over the last fiscal year, India's GDP contracted by 8.5%. So that's a very big drop. And also there's other measures. So if you look at satellite images of lights across India, the lights have dimmed very significantly, which is a strong measure of a reduction in economic activity. And now this is not just an abstraction, because India is a very poor country and the poor were particularly adversely affected. So we know that there's very, very direct effects on people's livelihoods. And in fact, I would like to know what the changes in inequality have been. And I haven't seen the data on this, so I don't even know yet. Now, the unfortunate thing here is that this was done in the service of saving lives, but there's a growing consensus. It's a tentative consensus, but it's growing, that maybe this didn't do all that much to save lives. And in part, that's because it was announced too soon, before a wave really took off, and without any advance notice, which particularly hurt migrant workers across the entire country. And in fact, one of the things we know is that COVID numbers started to rise a few weeks after the lockdown, which possibly points to the lockdown having been mistimed and mismanaged. So then what do we do now? It's not clear. First of all, we know a lot more about transmission, so that should help us better target lockdowns. But then the new variants have been leaving a lot of us perplexed. So we don't know exactly how those things work. And we also know for sure that there should be advance announcements and there should be cash transfers or food transfers to the poor that accompany these things. Now, there's also additional complex economic considerations that I'm just going to throw out there. I don't even know how they play out, but these are things that we might not have anticipated. One, for example, the Suez Canal blockage was very much in the news. But it turns out that something that's a lot less in the news is that a much bigger adverse impact on global shipping has resulted from India's COVID explosion, because India supplies a very, very large number of crew in the shipping trade. And ships are being blocked all over the world because of fears of Indian crew carrying COVID. So this is hurting not only global trade, but it's hurting a lot of people who are employed by that industry as well. On another point, we know that Indian schools were closed for a long time. We have evidence from the US that poorer children were very adversely affected by remote schooling. They had a relatively worse experience. And I wonder how that would play out in India as well. But that said, there is still almost certainly a need for a serious lockdown or a serious concern about focusing on saving lives. But one thing that I would want to point out is that a lockdown is not the only solution, that there's other improvements in healthcare that we could consider and we are considering. But unfortunately, India's starting from a somewhat bad place. One thing we know is that India is one of the lowest in the world in terms of healthcare expenditures as a fraction of GDP. So the infrastructure is weak to begin with. Now, just as a caveat, more expenditure is not necessarily good. The US spends a huge amount, close to 17% of GDP on healthcare. And that's not a sign of great healthcare, it's a sign of a dysfunctional healthcare system. So we don't want to just go in that direction. But as Divya and Vijay pointed out, we know that in terms of other markers, India has just very few beds per capita, very few doctors and nurses per capita. Those numbers are very bad. And there's also the explosion of counterfeit drugs and myths and misinformation, as Vijay pointed out. In fact, I might, if people are interested, my PhD advisor, Abhijit Banerjee, several years ago made a documentary film called The Name of the Disease. And that's available on YouTube. And it's quite an interesting depiction of the ways in which myths persist, myths about healthcare persist among the rural poor. Now, added to this domestic inequality in access to healthcare, there's global inequality. And the big question there, and this is the last thing I want to mention, the big question here is how do we get more supplies and more vaccines to poor countries like India, especially India that's suffering very much right now. So the US has finally started to release raw materials and surplus vaccine doses. And surprisingly, actually, the current US administration supported lifting intellectual property protections for big pharma. So if these things actually play out the way we hope they will, then one could possibly have more targeted lockdowns, and rather than like blanket lockdowns. But there are concerns here because there is going to be a lot of pushback from big pharma. And they have argued, and they will continue to argue, that this will reduce their incentives to innovate in the future. But they have already earned, like what we know that Pfizer's profits numbers came out, they've already earned substantial profits. So it's not clear why they should be earning rents on top of these profits any further. And in fact, if you think of the world beyond India, one of the things that's emerged is that the technology used in mRNA vaccines could also be harnessed to develop new forms of crops that could perhaps generate a green revolution for parts of the world that haven't seen it, like sub-Saharan Africa. So there could be these huge positive externalities from releasing this technology to the world that we should also keep in mind beyond the immediate crisis in India. So there's a lot of moving pieces. I don't know what should be done, but what does seem clear is that India should see more experts being visibly listened to. Maybe a little more like Dr. Fauci and the CDC in the US, the Trump administration's obsession with arguing against them notwithstanding. So it's particularly frustrating in India that the leadership continues to be averse to criticism, and they sort of use the garb of anti-elitism to reject all criticism. And to put it crudely, if you criticize from within, you're told to go to Pakistan, and if you criticize from outside, you're told that you don't know what you're talking about. So we hope that there's a change, just an openness to dialogue and criticism that can help us think about all of these considerations and design better lockdown policies for the next round.
Awesome, Karna. Thank you for your very honest opinions and insights. And I didn't introduce you, but Karna is a professor of economics at Hunter's College and a very dear friend who I've known for a long time. So speaking of governments and the criticisms against governments, I wanted to turn it over to Radhika, who's actually in New Delhi at present, kind of watching what's happening with the government. We all have similar views on Modi. But I do think that Radhika has a lot to say about community involvement and how we can better mobilize. So I'm going to turn it over to Radhika, who's an Atlas Fellow as well.
Thanks everyone, and thanks Karna for the closing remarks where you are actually hitting the really the nerve basically, because it's a systemic failure. It is a governance failure. Let's just address the elephant in the room. Let's just not go here and there. And I had an interesting trajectory. I think my friends in Open Gov Hub know that I was last year, the same time, I was in DC where Trump was ruling. And when I come back here, it's Modi ruling. So I've got a very fantastic political contrast from DC to Delhi and Delhi to DC. And while I am in this wonderful, discussion group, the cases are rising. We are at a very high time, rise today in Delhi. It's just increasing. It's like 340 deaths. The news is like it's increasing. Last year, it was also the people and the government collaboration where we were hailing, I was in DC and all the fellows from across the countries were coming to me and saying, hey, you guys are doing a great job. And you felt nice. You said, yes, it's a collaboration. They were prepared for a lot of things. Lockdown was done. Yes, it has its repercussions on the migrants. My heart goes out to them when we saw those images of, like Vijay would agree with me that how the miles long walk they were, subjected to take. Yes, it had, but we were able to reduce our deaths. We were prepared. And at that time, the media was hailing also the efforts of the Modi government. So now when things have become against the government, or it's a systemic failure, then as a citizen also, I don't understand that you talked about criticism, then criticism should also be taken with the same kind of spirit. So you can't be stupidly patriotic, just everything is going right. So that's something which I really wanted to state, even as a citizen, because, losing my dad last year, coming, and just 2 days ago, right in South Delhi, and I'm talking very humbly here, I am in one of the most poshest part of Delhi, South Delhi. Everybody knows that. And I just lost my relative 2 days ago because he was unable to find a bed in Delhi. That's the state of your healthcare system, my healthcare system. So as a tax-paying citizen, a common man or even a person in villages would not understand that how come you don't have oxygen cylinders, basic right to oxygen. This is human rights issues that we are talking about. And, mask was something which is being practiced by the citizens. And when I came in, I think in November, it was like as if COVID is gone. I could hear people say, hey, it's just gone. It's just gone. It's not there anymore. People just became very, very, reluctant to wear masks. The malls got opened, restaurants opened up in Delhi. It was like as if nothing is happening. Vaccines was to come. So I think it is also, we became very, very, irresponsible in our own behavior, but also you cannot just say that the government doesn't have any role to play. Every day, state government and center governments are just fighting with each other on 750 metric ton required by Delhi, and you're giving 350, 450. For me, it's not Modi, it's not Kejriwal. For me, it is the government. You have to come together. These are governance issues. And if in Delhi, I'm not able to have access to healthcare, which gets reported by media, Vijay would know what's happening in the rural hospitals. I mean, if there are any hospitals. So, and during this crisis, I mean, what has kept me going on, and thanks to Isa and Ambika, this was like motivation, when you get friends coming together and saying, hey, we are doing a COVID relief support, you don't know what it means. It's just very heartwarming. And I wanted to be my training as a sociologist is to be very objective, but I'm so sorry. It's not an objective situation right now I'm in. And my heart goes out to people, who are fighting for beds and breath. And there are oxygen lungers, Indians would know, which is like a community kitchen. You have a community oxygen lungers where people are coming together and, giving oxygen. I mean, it's something which it is a systemic failure. The government, and by the way, Dr. Fauci came yesterday to one of the media channels, and he stated, we should have a plan. There has to be a lockdown. You cannot just have, periodic lockdowns. You can't take that decision on. There has to be some stringent measures where you can now, last year, every 15 days or so, Vijay would know, or Divya would know, I would know, you would have the prime minister coming, talking about the plan, the strategy, and so on. And it gives, it instills confidence in people. So now, but what keeps me moving also is the power of partnerships and the power of collaborations, which I talked about, Ambika, because citizens have come forward, and it is very heartwarming. I mean, if you look at the images where people are coming with COVID tiffins, sorry, it's very scary to say that, but it's true. Individual efforts are coming. In Delhi, people are supplying these tiffin to COVID affected families and so on. Fundraisers, everything, every resource is getting valued or holds a lot of, weightage. But again, then you see in news that all the relief is getting stuck in an airport because of, we have mastered the art of bureaucracy. That's also one thing we have to say. 40 tons of your relief support is lying in Delhi airport, which is just 15 minutes across my house. So I think there's a systemic issue. communities have come forward. What this crisis have also taught me personally is also, and when I see around my own initiatives with friends and all, is the collaborations that people have coming together. So when governance fails, definitely people have come together. And I think it's very, very, it's disturbing, but there needs to be very, very stringent measures, especially healthcare system has collapsed totally. It has collapsed. And heart goes out to all the doctors, to the medical practitioners. Now you're roping in final year medical students to actually provide health systems. So sorry, I'm being a pessimistic right now, but I really wanted to talk about the challenges, the real on-ground challenges. What is getting reported, you and I both know, is very, very small. The challenge is huge. My own person, if he's not able to get a hospital, he had to come back and he lost his life. That is not COVID. It's because of no absence of total healthcare failure. So that's a governance. I'm a tax-paying citizen. I need my, already Delhi breath is also anyways, it's anyways killing, but no oxygen also on top of that. It's unbelievable. Unbelievable. Yeah.
I'm so sorry for your loss, Radhika. And I suspect that many people on this call have very similar situations as well.
Yes, absolutely, absolutely.
It's really hard to move on from some of the things that you just said, but I also I know some people had some questions on the chat, so I also just want to continue some of this discussion. Jacqueline Klopp is a professor here at Columbia, and she's part of our ACE program, which is specifically connecting researchers and practitioners. She works specifically on migrant issues in the Kenya-Uganda border. And I think from a lot of this conversation as well, I'd love to know how learnings in different places in the world and stuff can, what people have been suffering lack of resources, what if other places have done. I think Jackie has a question to ask. Maybe she can come on screen and ask it.
Yeah, thanks, Ambika, and also for all of you for organizing this. I'm speaking from New York City, where we also went through a really, really difficult time. We're pulling out of it a little bit at this point. So you have my complete solidarity. And some of us have been really advocating also for some more fundamental change and thinking. I'm also at the climate school, and there is the COVID itself is a global governance and policy failure. It's produced by also our economic models that have been enabling massive ecological destruction. And also, of course, we have a climate crisis along with the deep inequalities. And so, these things are linked. Increasingly wildlife diseases within wildlife are coming into human societies. It's linked to our destruction of their habitat. So we have a kind of huge ecological climate crisis. And if this is how we're handling, one symptom of this, we're in really deep trouble. So one of the things I noticed when we were struggling in New York, there was a growing interest among people in the environmental aspects, in part because with the economic shutdown, you could see cleaner air, for example. I'm wondering, I know right now you're in the middle of the most horrific crisis, but I'm wondering if there's any inkling of that thinking in India.
Happy for anybody to take this. You can just unmute yourselves.
Yeah, I can take that actually, because as a sustainability professional, and that's something which I too have been advocating on, the ecological resilience. And Vijay would like to I would really like him to also have his perspective, because the work that I was doing with Sam and others at the GovHub was on building ecological resilience, because of, you'll have more of the climate catastrophe and COVID is together. And issues like sustainable consumption, the way we are consuming, and the increase of plastic that has exponentially increased now with the plastic wastage due to COVID. All these, the ecological repercussions is something which we will see, or we are already witnessing now. And I think it's also the way our lifestyles have also have been impacted, or the way we have to live. As traditional Indians were conservationists, I'm speaking from India, so I can say that, sustainable consumption, the ecological conservation. We saw how the Ganges got cleared by itself because there was no human intervention. The flocks of flamingos coming to Mumbai. Nature has its own way of telling us. It's there inscribed in all our ancient texts, except the right-wing ideology, which they don't actually address the real issues. But other than that, these are critical issues. But if you ask me right now, I don't see that much. There are initiatives, sporadic initiatives on, the plastic consumption, reducing plastic waste, or going back to health and well-being has really increased, like the Ayurvedic diets and so on, and a lot to learn from the rural communities, by the way. I think Vijay would be a better expert to speak on that. But there have been thoughts. It is also going back to what we have been taught right from the childhood, or have been in our traditional way, but that's also the way the world has to live going forward. If you have to mitigate the adversity of COVID or any other kind of pandemics, the health and well-being and sustainable consumption and use of resources, that's something which the nature has been telling us. But I don't see such a very major interventions. I have personally not seen that in that way.
Did you have anything to add to that?
Yeah, I think no, thanks, Radhika. So, it is almost like, which cannonball should I first dodge, right? So, I think it is about surviving the one that I'm facing right now, and then I'll figure out what to do next, right? So, I think it's about each day as it goes. If I manage to survive today, I'll figure out how to manage tomorrow, right? So, I think that is the situation. Honestly, the system isn't. There have been pockets of conversations, strong conversations, and this is personally something that I was very happy about pre-pandemic, because there were some very strong voices that were coming out, which were really, sort of trying to highlight the impact, considering, the issues that Delhi was facing with pollution, with all the stubble burning, the agri-related, issues that, pollution issues that the northern states were facing, the issue of plastic that was getting highlighted, in some of the southern states, some very strong action that was being taken by some very interesting organizations that I personally know of. I know of some wonderful organizations who are doing some great work in terms of trying to address flower waste that was getting dumped into the Ganges and the rivers. So I was kind of getting personally quite happy that there are some strong voices that were coming out that were really trying to focus on these important issues. But again, here comes the pandemic, and it naturally throws all those conversations to the back burner, right? And now it's not even there as on the back burner right now, right? So it's about, and as Radhika said, it was probably nature's own way of maybe cleaning itself up. We did see some wonderful visuals of animals walking out on the street, wondering where have all the humans gone. Things kind of did seem better, but that was nature's own way of dealing with it. But right now, are things happening on that front? Are people worried about it? Honestly, yes, there are pockets of conversations happening around that front, but I don't think that's priority as of now. So yeah, I'm personally worried, but I don't know if that would be a priority, at least for the next 1 to 2 years. And that's sad, unfortunately.
Yeah, no, I was telling my husband, who works in climate science, I was just like, oh, well, this whole last year has really opened up a great moment for us to see the potential of what it's like to just slow down our lifestyles, even though we were forced to do so, not be traveling, and how much carbon savings. And I'm like, maybe people will continue to do this as we move forward. And he said, what's the first thing you want to do once lockdown opens? And I said, get on a plane. And he's like, yeah, you and everybody else. And so I do think that there's a lot of learnings that we're probably not going to be that active about taking Yokai, who is a colleague of mine and works on, and is one of our learning and research managers, specifically works on a project at Global Integrity with 7 countries in sub-Saharan Africa around COVID transparency and funds. And she had a question to ask around vaccine and vaccine apartheid and some of the patents. Yokai, if you'd like to come on and ask.
Hi, thank you, Ambika, and thank you to all the panelists and everyone who's donated and are doing this. I think, yeah, we often as the open government community, we talk a big game. We really talk a lot about the value and importance of transparency and accountability. But I think this pandemic and what we are seeing sadly unfold in India and around the world is just how issues of transparency, accountability are actually matters of life and death, and I think for a long time, the community has struggled to make that connection. We talk about transparency for transparency's sake, accountability for accountability's sake. It's to ensure that situations like this don't happen. And I think, yeah, this is actually a great time, a wonderful, wonderful opportunity for us to step up as the community and to really advocate for better governance and for accountability and transparency around COVID funding, especially. And that's what we have started as Account for COVID, which Ambika spoke about. And we're just getting a group of civic actors around Africa to get governments to account for how they're spending their funds. And one of the webinars we held was with the panelists from South Africa. And if you're aware, India and South Africa were among the 2 countries that first approached the WTO last year to request for waiver patents, for patents to be waived so that they can manufacture. Because at this rate, developing countries will inoculate their their citizens in 5, 10, 20 years, and we actually don't have that kind of time to wait. And I think profits can be set aside. So when we did have the webinar, one of the things that they raised at the South African level is that they are engaging in litigation. They're really pushing the regional institutions, Africa Union, etc., to really put up that pressure and amp the heat. And I think we're starting to see some results. And I was just wondering from the panelists if you could share a little bit more about what we can do to keep up the pressure to make sure that governments and foundations and donors give in and pharmaceutical companies give in into the waiver patented calls right now.
Karna, I know you were talking a little bit about some of the vaccine patent issues. Karna, would you like to sort of go into this? Because I do think a lot of it has to do with capitalistic interest and international economics.
Sure. Thanks, Yokai. So the standard argument for why you need intellectual property protections, whether it's for whether it's for life-saving drugs or for someone writing a book, is that people are going to be incurring a lot of costs. In the case of drugs, you're incurring a lot of R&D costs. So if they didn't have these protections, they would just end up making a massive loss. So they would not be able to produce this stuff at all. But I think but clearly that's a specious argument, because the sizes of the profits that we see in the pharmaceutical industry are so huge that it's hard to see that that is necessary as a way to protect them at the stage of research and development. So I think what you're saying about this, like this global, this alliance of countries, especially alliance of countries in the South, trying to poke holes at this argument is very important. Now, one of the things that I think would be also very useful to point out in this particular context is that this is first of all, this is a humanitarian crisis. Second of all, we really don't know that such big profits are necessary. We're almost sure that they are not. And thirdly, in this particular context, and I don't know a lot of details, but I have been reading journalistic pieces about how, for example, the Pfizer's vaccine, for example, was mostly bankrolled by the US government. So this whole argument that they need to make profits after the fact because they incurred a lot of R&D costs beforehand, that argument doesn't seem to hold in this case. So I think trying to actually scrutinize this claim about pharmaceutical firms going underwater unless they're allowed to make ex post profits on these vaccines, it's something that's happening. And I think that an alliance of countries is totally capable of doing that even more aggressively.
Okay, thank you so much for that. Isabella, who is the lead and our organizer for today's event, had a very, very concrete question around why is the government failing? I mean, is it kind of inevitable? We have a huge crisis on our hand. Is it a capacity issue? Isabella, do you want to come in and just ask?
Yeah, sure. So basically, the governance failure can be twofold or manyfold, but just to narrow it down, it can be a capacity issue. So not enough funding, not enough people, or is it corruption? Is it just blatant stealing of money and resources in this crisis? And on the flip side, what is the biggest point of resilience for CSOs on the ground and the people in India?
Divya, do you have any thoughts that you'd like to? I'm sure you've talked a little bit about the CSO situations as well in your writing.
Sorry, could you repeat the question? I think my connection was a bit weak.
Yes. What is the biggest point of resilience for CSOs and the people in India in the face of governance failures? And if anyone has time for my second question, or the primary one really, is it capacity? Is it corruption?
I think I can speak mostly from the media and journalism point of view. And in terms of, I mean, I don't know if I can say corruption at this point, but I think if we can talk about government inefficiencies, then I could say that just prior to the first lockdown, just hours before that, actually, I've read articles in which I say that the Modi government actually told media to spread positive news about the about like, oh, it's not really that bad, like, downplaying the situation quite a bit. And in my opinion, I think that's honestly like very, very, very ineffective, because the media is here to provide a transparent point of view, right? And also to show that the government has inefficiencies, and the power of media is to hold power to account. And I think without that, I guess you could call it corruption in some form, but yeah, that's pretty much what I'd say.
Radhika, do you have anything to say about this?
So I think Modi government, even before COVID, was very good at image building. So I don't think so that's such a, they don't, even if they pay to build the brand Modi, that has been happening since 5 years, they are very good at it. But COVID may have escalated that. But for me to answer your question, Isa, by the way, it's a great question. The CSOs have been working really, their work has escalated. One of the biggest reasons that COVID-19 relief support is being given to community, especially when the migrant crises were taking place, it was the CSOs. I mean, and I'm not talking about the Save the Children's of the world or CARE, they are doing great work, but I'm actually talking about the grassroots NGOs who are actually working on the ground. And I could see that because of the experience that even I was dealing with, more than 30 organizations right sitting in DC who were working in the 9 states of India. And they were working very closely in the villages and remote part of those villages. So CSOs were doing great work, but their work it never gets, de-escalated at all because of governance, because they have their own state governance, which is BJP, no BJP, Congress-led. So they're they know that aspect, that it will be a systemic failure. It is a local governance failure also. Hence, local NGOs, local platforms have to come up, and people's collaboration is important. And that's why you have these migrant workers. The government couldn't do much except providing, rationing and so on. But the help was given by the CSOs on ground. So there was a new kind of, more impact that CSOs are bringing. And I think Vijay would be, really providing more details also on the critical nuances. But the other aspect of corruption, why is this happening? I think it's a mix. It's also they were unprepared. Karna already stated that in some way they were not listening to experts. 6 months before, all the experts have told them that, look, this is going to escalate. In Chennai, when the movie theaters were getting opened, a big letter was given by medical practitioner to the state government saying that, look, we are exhausted. Please do not open indoor movie theaters. We are not done with it. And still, you have 70% capacities. The movies were on. People were traveling. Indians, we are crazy about weddings. And we don't want to stop our weddings. So we have to take responsibility on ourselves. My own relatives, they got COVID because some of the other weddings they had attended. It's 120%, positivity rate if you attend a wedding in India. And still it's going on, processions are going on. Yes, rallies are important. They're very important for political parties, but it's being carried on. So you're not listening to the experts. They were giving warning signs. And I'll end with that. When I was in DC, I told one of the fellows that, you know what, if it escalates this much in India, it will be a catastrophe. Every Indian citizen knew that. And so it's a collective responsibility. Last year, you could do this well because it was a joint collective responsibility there. And transparency is there. Everything is there. What is getting reported, by the way? It's there. How many vaccines? You're having 15.8, I think lakhs have just got vaccinated, or crores, sorry, have got vaccinated. And you still don't have vaccines. My mom she's a cancer patient. And I'll just make it very quick. She's a cancer patient. She's a diabetic. So she's high comorbidity. And she was the first in that 45 above age group to get vaccinated. She can't get her second dose because there's no vaccine. And the hospital is just next door. So there is an unpreparedness. They didn't listen to the experts. You have to listen to your experts. There has to be policy. Where is the preparedness? Again, just like oxygen cylinder, the state and the central are having a tiff. We have vaccines, we don't have vaccines. Now, as a citizen, I'm bored with it. I need my vaccine. I am ready to get vaccinated. Please give me the vaccine. Where is it? If it is not, it's a systemic failure. That's where issues of corruption and lack of responsibility and accountability comes into picture.
Wow. Well, I really appreciate those words. And I know we're at time. So I wanted to see if anybody else had 30 seconds of how we're going to get out of this. I mean, I know we may not get out of this, but if we were going to get out of this, what would we do? So if we could just do a speed closing round, and we can start with Karna, or we can start with Vijay.
Okay, I can start. So I don't have an answer to the most important question, the one you just posed. But so my only closing point is that I'm really glad that for those of us who feel helpless in many other ways, especially myself, and since I'm away, the fact that there are initiatives like this, both in terms of conversations and in terms of actually getting money, to whatever little extent small amounts of money help with getting services and healthcare to, especially to the poor. I think these are very useful small interventions. So that's really all I have to say. I'm basically thanking you for this.
Oh, thank you. Thank you guys for being here. Vijay?
Yeah, I mean, I just wanted to, in fact, just pick on what Radhika said. It is understandable that the situation, nobody would have expected, nobody would have kind of prepared for it. But I think the system, or it is actually a reflection of not just the failure of the government, but also as a society in some ways, right? So because I think naturally nobody prepares or is able to, as I said, these were gaps that were already there, right? So suddenly there is a pandemic, and you can't scale the health system overnight, to meet the complete country's demand. demand. So that is understandable. But I think the maturity of a system or a society is also tested by not by how you prepare for such emergencies, but how do you react to such unexpected emergencies. I think that's where there is a gap. Now, what do we do about it? Now we all know about the challenges. I think one of the key the beliefs in Grambani is that policy specifically targeting communities welfare or equality can really rein in these norms or ideologies, right? Policies can really do a lot, but in a democratic setup these policies have to be demanded by the people. And one of the reasons why I say that it is also a societal failure is because we've all been sleeping over it, right? So we've all not been demanding enough from the government, we've all not been demanding enough accountability, right? And people will only demand good policies once they are able to understand these processes behind the reproduction of these inequalities, right? So where does it come from? Is it social, economic, cultural? What reasons, right? So it could be now. Imagine this is the case of urban educated class. Now imagine a large segment of the rural low-income population. They do not have access to information. They do not have channels to voice their opinions. Nobody listens to them. Nobody asks them whether these policies really make sense for them or not, right? So how do you demand accountability unless people are on the same page, unless people understand why are these gaps there, why are they being excluded? They will not be able to demand for better policies and better implementation, better access to services, better quality of services. And I think that is where there has been a significant gap, and that is why I believe that it is a societal failure and not just about the government. And I think it is I think the clapping has to happen with both hands, honestly. Yeah.
Thank you for that. And Divya, if you want to just say yours.
Yeah, so I'm just going to be really quick and say that from a media standpoint, there are two things I think that we can do better. So number one is give experts more or at least as much coverage as you give politicians, because they need to be the people leading the response, especially in terms of exchanging information. And number two is also to develop some form of unified bulletin, public bulletin, because as Vijay said, there is information going out to the urban population, but the rural population is almost completely in the dark. So if we can find a way to send a unified bulletin in different languages, at least even in different forms, so I mean, if not online, then at least on paper or whatever, I think it would be really helpful, and people can start to behave in the right ways in order to bring this surge down. Yeah, thank you.
I appreciate that. And Radhika, to wrap it up.
Thanks. Just two pointers. One, there's a lot of apprehension amongst, Indians not getting vaccinated also, though there is a shortage of vaccine, but still, just get vaccinated. I mean, I would request every one of us to get vaccinated because that's the only way out as recommended by the medical practitioner, whether it's Poonawala's vaccine or Putin's vaccine, just put it. I mean, for me, it's Poonawala. I'm being very upfront. And second, please share positive stories, positive initiatives. Mental health is also one of the biggest crises that's coming along with COVID. And thanks to all the COVID heroes who have been really working across the communities, share those stories, share those initiatives, because ultimately the power of India is in its people, and they win. And we are already winning this crisis. So thanks to you, and thanks to all the people, I mean, very humbly, who have come and are supporting us. It's very overwhelming. I'm actually very touched. Thanks so much.
Thank you. And thank you all of you for joining so quickly. We only decided to do this fundraiser, I think last Wednesday or Thursday. I was absolutely destroyed with what was happening in India. And usually it takes us weeks and weeks to plan an event, but I knew how much of this was in the forefront of people's. And so I just really appreciate everyone being like, yeah, of course, we'll be there. We can talk about this, and just being really honest. And of course, for everyone donating, we've made almost, we've surpassed $2,500, which is great for 5 days. The link will be open up today. And just so to be clear, that the organizations we're supporting are specifically dealing with the issues we're talking about today, which is oxygen, as well as food supplies and things like that. So that's really important. And also, I just wanted to end with a huge shout out to Isabella and Veronica, who actually are doing the work. Veronica, I mean, I just have brown friends who I really like, but Veronica actually has been promoting this stuff all week and getting people out there. And Isabella has been managing all the Eventbrite page, everything, and all this stuff. So just a huge shout out to them so much for putting this together and all this work. They're an incredible team, and they're always on top of things. So thank you, everybody. And we'll keep on keeping on. Thank you.
Thank you. Thank you so much, everybody.